Many chief nurses know the DAISY Award and are familiar with the DAISY Foundation. So we know how that has contributed to nursing celebrations, and the acknowledgement of nursing at the bedside. And the FACES Foundation is another reflection of that, and an opportunity to do the same for our respiratory care colleagues. And we all recognize what our respiratory care colleagues do day in and day out. And I think most of us would welcome an opportunity to partner with the FACES Foundation to be able to provide that type of recognition for all of our staff.
Respiratory therapy isn't the most glamorous healthcare profession out there, and we are sometimes not as well known as the other healthcare professions such as nursing and physician and all that. So Phil Award, being its nationally recognized recognition program, it gives us a lot of exposure to be, to hear, let our stories be heard outside of our own hospital system.
And so often when we think about the heroes, certainly over the last year and a half during this pandemic, we can always think about the physicians and the nurses, but often lost in that group of that team is the role of the respiratory therapist. And so I think this award allows people within the organization outside of respiratory therapy to reflect on what they've experienced and to share their appreciation for the respiratory therapists they work with. So this award's very special in that it allows that to occur.
After the year that we experienced last year, something like this was even more meaningful and seemed more important to me, because I've always been so very proud of our respiratory therapists, and what I witnessed them accomplish last year was incredible. Nothing like I've ever seen before. So I wanted an opportunity to make it more formal and to open it up to patients and families and other disciplines within the hospital to nominate and recognize respiratory therapists.
I enjoy the Phil Award because it's specialized and centered around us therapists as a whole and everything that we do on a daily basis, whether it be the care that we give to our patients physically or the emotional support and care we give to the family members that we're caring for the loved ones of. And like the DAISY Award for nurses, it just shines a light on us as a department in whole, or a career field in the whole aspect, that this is what we do, this is what we specialize in, and this is what we take pride in every day. And so that's why I like it, because it showed that we care enough for our patients that others outside of our scope of practice recognize it, whether it be team members or family members of patients.